Thank you very much, Jen, for your introduction, and thank you to the organisers of this event. I remember years ago when I first started working on issues of child migration, particularly problems of unaccompanied children, we congratulated ourselves when we managed to get lawyers who knew about migration and lawyers who knew about child welfare in the same room, and we saw this as a hugely interdisciplinary exercise. So now to be in a room where I'm actually sharing a panel with somebody who's talking about neuroscience, and I'm a lawyer, is a big step forward. It just shows how important this sort of wide-ranging, holistic interdisciplinarity is, as was discussed earlier. So it's really, it's wonderful to be contributing to this exercise. I just wanted to start off by linking my comments to a couple of the points that were made earlier this morning, and I just wanted to pick out three, which I think came from the long and interesting panel that preceded this one. Firstly, I think many people emphasized the importance of research. Secondly, people talked about the difficult economic climate and the resource scarcity that many of us now confront. And thirdly, people talked about the translation of research into policy. And what my presentation really is about is those three elements. It's really about trying to figure out a way for making difficult choices more easily. Given that we can't do everything, we can't do all the things that are optimal for improving the circumstances of children outside families. At least we can't do all of them straight away. How do we make choices? How do we, as policymakers, decide between different components? How do we assess the costs of various options? And what I'm going to be talking about in particular, how do we assess the costs of not taking certain actions? So what I want to present you today is a new approach which our centre, the Francois-Xavier Bagnoud Centre for Health and Human Rights at Harvard, has been developing. The starting point is this. Economic evaluations typically focus on the costs of an action and on what one might call the constitutive benefits of an action. So, for example, if you think about a healthcare intervention, the constitutive benefit of that healthcare intervention is health. If you do a healthcare intervention, a benefit that comes from it is going to be health. If you think of an intervention which improves access to education, then the constitutive benefit is educational gain. So it is, of course, important to consider the costs and the constitutive benefit of an action when you're deciding whether you're going to implement it or not. But what the cost of inaction approach that I'm going to be discussing suggests is that to really evaluate your options, you've got to go beyond just the constitutive benefits, and you've also got to think about the consequential benefits. What do I mean by that? The consequential benefits of an action are the benefits that result from the negative consequences that you avoid. That sounds a little bit circular, but it's an important idea. If a healthcare intervention is not implemented, then the continued ill health of children may lead them to drop out of school and therefore to have lesser educational attainments. Dropping out of school may lead to increase in risk behaviours, crime, drug addiction, and there may be a host of other negative consequences. So to take account of the benefit of avoiding those consequences, you're really increasing your understanding of the benefits of taking a particular action. So the basic point is, when we are evaluating among different options which ones we take, we have to have a broader conception of the impact of our choices than just looking at what I said was the constitutive benefit. We have to look at a broader picture. And what we're proposing is a mechanism for doing that effectively. So let me just say a little bit more about the cost of inaction. It's an approach that proposes that actions should be evaluated, net of their costs, in terms of both their constitutive and their consequential benefits. Now, one of the ways in which this approach differs from a classic cost-benefit analysis is in that we argue you can't just look at monetary terms. You have to have a more complex approach which looks at both monetary and non-monetary consequences. As Jack was just saying, a lot of what Jack talked about would be very difficult, I think, to quantify monetarily. There may be some monetary consequences that flow, and as Jack said, you could show how some delayed interventions end up costing us much more. But there are many other consequences which aren't directly monetary. So what the cost of inaction says is that a useful way of evaluating realistically the desirability of making one choice rather than another is to link up both quantitative and non-quantitative benefits. So by specifically considering the consequential benefits of an action, that is, the actions that wouldn't flow if you didn't do something, the cost of inaction approach draws attention to the whole context in which policymakers are making decisions. Many consequential benefits are determined by what other actions are or are not being taken. So we're really talking about a complicated context, as we all know. It's not just one isolated intervention. If you're talking, for example, about providing foster care, the Senator was talking about earlier, rather than institutional care, you have to train foster carers, and in order to train foster carers, you have to have trainers, and to train trainers, you have to have courses for the trainers, and so on. So you need to look at, if you like, a whole ecology that supports what might seem a very linear change, like increased foster care. So that's what we're trying to address. How should decision makers really have a picture of all the desired changes that they want to start promoting? So if the net benefit, so the benefit of an action less the cost, is likely to be greater for a set of actions than a single action, then that is the alternative we should be looking at. In other words, if we have a situation where we have institutional care and we want to move to foster care, we can't just evaluate the costs of foster care. We have to evaluate the costs of foster care, including all that set of actions, to get a realistic sense of comparison. So, moving from the theory to the practice, one of the detailed studies that our centre undertook to really flesh out how this cost of inaction approach would work was work in Angola. And we looked in particular at what it would take to strengthen the education system in Angola. We started by looking at the overall context, understanding the fact picture before the intervention. That's a basic starting point for any such assessment. You have to really know about the context in which you're working. So in the Angolan context, for example, as a result of the 27-year civil war and high rates of income poverty, many children found it difficult to access education, health and other basic services. And as the slide shows, in 2009, the most recent year for which we could get data, 34.2% of students lived further than a 1¼ mile radius from a school. 10% of children in Angola don't even enroll in grade 1 of primary school. So if you think again of Jack's graph, and you think about the pretty steep way in which your brain function is declining, you can see the net loss that that situation causes. If you're missing out on primary school at that stage, you're really heading fast down that slope. Not only that, but a large percentage of those who did enroll in school drop out before they complete primary school. And there are various factors which contribute to the failure to enroll in primary school. So what did we do with that information? We looked at the way in which this deficit in the education system has other spin-offs. We looked at the way in which it led, of course, to many children not going further in school, to secondary school. And we looked at the way in which this whole set of educational deficits contributed to children having very limited exposure to any form of literacy or numeracy. So the situation we start with then is one in which the core problem is that you have a population, many of whom are illiterate and innumerate. Strengthening the education system then, we looked at what options we could take. And just by way of example, we assumed that if we were to increase certain types of action, the population that got an education would increase, and that this would have all sorts of consequential benefits. So we looked at and we evaluated the cost of building schools, of training teachers, and of developing new curricula. These are fairly obvious actions which could be undertaken. And we calculated that if these steps were to be taken by the Angolan government, these results would follow. And I should say that all our calculations are based on empirical data. So these are not just speculations. We are extrapolating from empirical data that is already available. And one of the principles of this approach is that you only develop calculations of benefits, constitutive and consequential, using good empirical evidence, so that the calculations you're making are really based in an evidence context. And so in that way, we calculated these benefits that would flow from increasing access to schooling. But it's not just that. Those would be, of course, the constitutive benefits. Increasing availability of school would increase access to education. But the point about this research was to show that there would be other consequential benefits. And these are some of the ones that we noted, based again on research that exists, which shows the relationship between literacy rates, numeracy rates, and the ability then to bring up your children healthily, to earn money, to provide in your family. So the consequential benefits of strengthening the education system in Angola would include fewer maternal deaths, fewer under 5 deaths of children, and a 40% reduction in the total fertility rate. So this single action, this single set of interventions, would not just improve education, it would improve all this. And so, of course, the point for policymakers is when you're trying to sell a particular intervention and you're up against many others, the stronger the case you can build, the more benefits you can show you are bringing, the stronger your case is going to be. So I think one of the most important takeaways from our methodology is to say that when we're considering interventions for children who are outside family care, we have to really look at the whole context in which our interventions would be working to really give a good picture, so we can justify the costs by a whole set of different interventions. In the interest of time, I think I probably won't go into the Rwanda example, which is sort of builds on some similar points. And let me just sum up, and of course I'm very happy to answer questions, just to say that what is the point of this new approach, which sounds somewhat complicated, the idea of constitutive benefits and consequential benefits. The point of this approach really is to try to help policymakers to lay bare the assumptions that drive difficult choices. To say, let's understand what the consequences of doing X and not Y are. For example, in the background papers for today's meeting, there was an interesting sentence which said, we don't understand why, despite all the evidence and despite the cost, we still use institutional care much more than foster care. It's more expensive. It doesn't work, it harms children. Why are we doing it? Now, one way of really trying to get at that issue would be to say, let's cost out what institutional care costs, what it costs to maintain the buildings, what it costs to train the staff, what it costs to own the land, what it costs to transport the children from wherever they are there, what it costs to get the children out of there eventually. And let's then cost what foster care would mean. And as I said, not just the immediate money that you pay to the foster parent, but all the other things that it takes. If you did that, you could say, well, the net cost of foster care, take the actual cost minus the benefits, the net cost is going to be this. And let's compare it with institutional care. And let's see all the other knock-on benefits. It's not just that we are giving children a better life than the 10 years that they're in foster care or however many it is. We're also reducing risk-taking behavior. We're also, in fact, reducing depression. We're reducing institutionalization. We're reducing crime. We're reducing addiction. We're reducing HIV/AIDS and so on. So then the argument for moving from institutional care to foster care becomes much more powerful. So to conclude, I think what we are hoping with this framework is to help policymakers and ourselves to really organize the complicated data we have, all the empirical information that's out there in a way that can be made sense of, where we can actually then really evaluate our choices in a more rational and useful way from the point of view of the communities we're trying to serve. Thank you very much.
A lot of food for thought. Any questions or comments on the framework or the potential use of the framework? Go ahead. It was a very good presentation and very interesting. And to me, you present a very important argument. But I've always felt, in particular, that institutional care is sustained because it's so much better to put your name on something. And that major donors love to put their names on institutional care all over the world. So how are you going to get your data to come together with people's emotions?
So that's actually a terrific question. I'm not sure how good my answer is. The first point of my answer is that it's critical to look at monetary and non-monetary benefits. We have to look at evaluating what would be, so if you give up institutional care, you give up the naming opportunity, that's a cost. So how do we compensate for that? Let's take a vector for what other opportunities there might be that would enhance people's emotions. So you could have the so-and-so foster care bill. You could have ways of incentivizing people to increase the number of children who are in foster care. You'd have to think about that. I think the basic point is that you would put that on the list of issues which needed to be addressed. And so somebody who was seriously researching this would have that as an element to think about, not to ignore. And that would then help people think more tactically, I think, about mechanisms for addressing it, for addressing that particular issue. That I think is my response to that.
I may want to just add something to that. I think one idea that might move people is the idea that we just heard from both of these extraordinary professors and the professors that are in the room. I mean, this study of the brain and the science that comes out of this, I believe, is game-changing for the world. Now just bear with me for 1 minute. Since the beginning of time, people have thought, mistakenly, we've all made a very bad collective mistake, big mistake, that all infants needed was food, shelter, or children needed food, shelter, and some health care. And that they would be perfectly fine. Really. The whole world operates that way. And what some of us, including Secretary Clinton and President Bill Clinton, and I believe President Obama and Michelle Obama and other leaders that are focusing on this issue laser-like, is that is a really big lie. And the science now proves it. This isn't just a moral question, it's a scientifically proved beyond a shadow of a doubt. And this information really came to the world, came to the US first, I believe, maybe I'm wrong, but I think it was our scientists, I could be wrong, but came to the world about, what, 25 years ago? You think, doctor, or is it longer than that? Maybe 50? Or maybe it just got to Washington 20 years ago. We are a little slow. I mean, so I'm sure maybe the scientists knew about this.
But people in Washington, policymakers that are clear, our job is to try to figure out these things, we all do. I can remember, wasn't it Tim Reiner that came here with and Secretary Clinton brought the development of the brain, and it was a big deal when she was the First Lady. She tried to explain this to everyone, and I think some people listened, a lot of people didn't. And now we're here again. Yes, food is important, water is important, but what a child needs in terms of developing is this, like the Secretary, the representative from Labor, it's a protective, I would say nurturing family environment. It could be a very poor family, but it's a nurturing poor family. There's a big difference between a nurturing poor family and a non-nurturing poor family. What comes to mind is a poor mother, whose mother was poor, but whose mother had gotten that tolerable stress thing worked out, and taught the daughter about tolerable stress. And now the daughter is poor, the mother was poor. But what happens to those children in that very poor family are very different than children either alone, out on the street, or in a family where toxic stress has been in that family, an extended family, generation after generation. I think that's the way I would interpret it as non-being a science. So the answer is, how do we get people to take their names off of institutions is to make them watch this presentation, like 10 times, and then take the test on it. And then maybe we'll stop building institutions, and the good professors can go giving out A's to everybody that watches it 10 times. Thank you.
Thank you. I'm going to ask, because I want to be a nurturing moderator, and I know you need coffee, for each of our speakers to just say one concluding remark. And they'll be with us for a while on the break, and if any of you have further comments to them, can come up.
Well, I'll just pick up on the Senator's comments and say that I think the question of how long have we known all of this, I think what's most powerful right now is the convergence of very sophisticated molecular biology, behavioral and developmental research that we've known for decades, and common sense. And when those three come together, boy, that's powerful. So what science is doing is it's really helping us understand, get under the skin, into the body, at the molecular level, understand things that basically are intuitively obvious to a lot of people, and that social scientists and developmental researchers have been trying to say for many years. And in all due respect, somebody puts a brain scan with a lot of colorful pictures up on a screen, and everybody says, oh wow, this is really important, I can do something. And you're absolutely right, but it's basically, they're all saying the same thing, which makes a very powerful case in my mind for not only the political will, but now I think the even more important question is, what are we going to do with that knowledge? Because just having it doesn't mean that the world suddenly gets better. And so we need not only to continue doing the things that make a difference, but figure out how to use the science to take it to the next place. I think we need a 21st century approach to these things, which could be much more effective than things we've tried in the past.
Thank you. Isaac, I'd also like to just make my last comment, sort of building on what the Senator just said about the example of naming and how one might address that. So I think what we're trying to say is that by making explicit the assumptions that drive policy, implicit assumptions, or implicit rewards, implicit kudos, we're really helping ourselves to at least be honest about what our value systems are. So that, take this question of, how do you get funds to make things happen? Partly you make people feel good about it by naming institutions after them. So say you to show instead that by supporting parents, poor parents, you might prevent a family from being broken up. You might prevent a child from being dumped in an orphanage and then transported somewhere across the world. That you might enable a child to grow up in a poor but nurturing family if you gave the family the resources to do that. We could then factor that into this equation. So we could say we have a much richer canvas. Many people might love then to have their name associated with family preservation rather than with an orphanage. So I think what we really need to do is just like the science shows us sort of the way brain wiring indelibly happens from the beginning onwards, and so, you know, how time is short in a way, and what the consequences of our actions are. So I think what this sort of more policy-based approach shows us is, again, that time is short and that our choices are inevitably constrained. So let's really look at what drives them in a non-partisan way. Let's collect the evidence. Let's use the research funding that we have. And one of the colleagues was saying, you know, times are tough, so we're going to spend more on research and less on implementation. Let's use that research to gather these sort of complicated variables and have them in a clear chart, so we then can evaluate and then we can make decisions openly based on the science and based on our values. At least we know why we're doing it. So we think that this will really be a helpful addition to improving the situation for vulnerable children.
Well, Jacqueline and Jack set us up for the rest of the day. We thank you. Please join me in thanking them. Coffee break, the well-deserved coffee break. Please join us.